Good afternoon. I'm Carlos Fernandez, Policy Analyst at the Vegas Chamber. I'd like to thank you all for tuning into the Insurance and Healthcare Policy Committee, co-chaired by Vicky Van Metern of Roseman University, Frank Nolamo of Assurance Ltd., and Dulcinea Rangavela of Cragen and Pike. Before we get started, I want to take a moment to explain some features of this call. In order to preserve a high sound quality, we'll be muting everyone on the call besides our presenter to make it easier for everyone to hear. If you'd like to ask a question, there are a few ways you could do so. If you're joining this call on the web or through the mobile app, you can ask a question by using the chat feature on the interface. We'll ask a question on your behalf. You can also ask a question by clicking the hand raise button on the interface. We will call your name and unmute your line so that you can ask your question. Once you've asked your question, we'll remute your line so everyone on the call can hear the answer. In order to preserve time, we ask that you please keep questions brief, and we'll be taking all questions at the end of the call. Today, we'll get to hear an update on COVID-19 from Dr. Cort, Lohff, the Residency Program Director at the Southern Nevada Health District. In his role, he is responsible for overseeing the training of physicians for careers in preventive medicine and public health, and provides support to other training and educational efforts within the district. Prior to taking his role in 2018, Dr. Lohff served in various roles at other local and state public health departments. He received his MD from the University of Wisconsin-Madison, his Master's in Public Health from the University of Michigan. Now please join me in welcoming Dr. Cort Lohff.
Great. Thank you, Carlos, and welcome everybody to this presentation. So I'm going to just give a basic overview of the coronavirus disease response and talk about what this virus is, how it spread, symptoms, and then attempt to answer any questions that you may have. All right, so let's see. Okay, one of the things I want to highlight first off is that the health district, as a local public health entity for Southern Nevada, we do have a hotline available to members of the general public. Folks can call in from 7 a.m. to 7 p.m. That number is on your screen, 702-759-INFO. So just a quick overview of my presentation today. I want to give a short background on this virus, talk about how the virus is transmitted, some of the common symptoms, current issues around testing, talk about exposure risk, and then finish up by talking about ways to prevent this disease, as well as some resources that are currently available. And certainly I want to hear from you all in terms of some of the questions and concerns that you have. So just by way of background, there are many different types of coronaviruses. In fact, some of the viruses that cause a common cold can be classified as coronaviruses. You may also have heard of the SARS and MERS viruses. Those two are coronaviruses. But the so-called COVID-19, or the coronavirus that we're currently experiencing the pandemic with, is a new or novel virus that was initially identified in China and caused the initial outbreak there. It's a new virus. It's quickly spread around the globe, of course. And the WHO recently declared this a pandemic. The unfortunate thing is that because it is a new virus, there's many things about this virus that remain unknown, which of course complicates our response to it. And of course, prevention is the key here. Unlike other types of diseases, including influenza, there is no vaccine. There is no specific treatment. So the best we have right now is supportive therapy. This is a map developed and put out by Johns Hopkins University. You may have seen this or heard talk about this in the media. This presents it's a map globally of all the cases and the relative distribution of cases across the globe, as well as the number of confirmed cases to date. You obviously can see as of a couple of days ago, China had the most cases, followed by Italy. And I understand that Italy is, the number of cases in Italy is increasingly exponentially as well, as is cases around the rest of the globe. This, of course, is a map of the United States showing the relative distribution of cases here as well. And I do want to say a little bit about what's happening here in Southern Nevada. So as of yesterday, we've had 74 reported cases. These are lab confirmed cases of the virus, and including one death. In contrast, about a week ago, we had only 16 cases and no deaths. And of course, we expect these numbers to continue to grow exponentially over the course of the next several weeks. So how is this virus transmitted? Again, there still is some uncertainty about exactly how the virus is transmitted from person to person. Most believe that that transmission is that the virus is predominantly transmitted person to person through close contact, defined as 1 meter or about 6 feet, and that transmission occurs through respiratory droplets that can be expelled through coughing and sneezing, and people are most contagious when they are sick. Some of the concerns are, though, that there is a suspicion that folks can spread the virus from person to person when they're asymptomatic. But again, there's not a lot of evidence that this is a major source of spread at this point. There's also concern that the virus may be spread through contaminated surfaces. For example, if someone were to cough or sneeze on a surface like a doorknob, and someone then later came by and touched the doorknob and then put their finger in their mouth or eyes, there's potential for a transmission that way. But again, a lot is not known about this virus, and there's not a lot of current evidence that transmission is through contaminated surfaces. But as a precaution, we're obviously advising folks that it is a possibility and encouraging the proper methods to prevent transmission through that way. And then, of course, we're now in a situation in the United States where there's been community spread of the virus over the last several weeks. Initially, of course, the spread has largely been due among patients or those who have traveled to areas of the world where there was virus outbreaks, such as in China. And those travelers came back to the United States and subsequently transferred to other people. But at this point, there's community spread of the virus, and which is where we're unsure how people have been in contact or unsure how people have become infected that way. So that's where the big change has been in the last few weeks. Again, initially it's been introduced from travelers from overseas, but now there's widespread transmission in the communities pretty much all over the United States. So after a person is exposed to the symptoms, generally generally symptoms will occur anywhere between 2 to 14 days after the exposure. Symptoms can vary from being very mild to severe. And a person's age and underlying health conditions will determine whether or not they will have a mild versus severe course of illness. Of course, the elderly and those with severe underlying health conditions are known to have much more severe complicated disease than otherwise healthy people. Mild illness is typically presents as fever, cough, and shortness of breath. Those that are experiencing severe illness may have difficulty breathing, experience pain and pressure in their chest, may be confused, and you might see that their lips or face are turning blue as a result of lack of oxygenation in the lungs. So testing has of course been a big issue all over the place, mostly because of the lack of testing capability. What we're doing here at the health district is that we are prioritizing testing for those who are close contacts of known cases. So what we do here is that we receive reports of persons who have tested positive for this virus. We in turn interview those people. We identify their close contacts, again, people that might have had prolonged contact with them, and we contact those people. We ask them about their signs and symptoms, and then we ask them to go into self-quarantine for a period of 14 days. Let's see. In terms of the recommendations we're providing to the general public related to testing, we are asking members of the general public if they're symptomatic, to call their provider. In a lot of cases, testing may not be indicated. Certainly, if folks have underlying illness or may need to be admitted to a hospital, then certainly testing would be indicated for those patients. But generally, those who are presenting with mild, uncomplicated illness, testing is not always necessary. We do know that there is some capacity within reference laboratories such as Quest and LabCorp for testing as well. That, of course, changes on a daily basis. And we do also know that because other viruses may cause the same spectrum of illnesses, that there is testing for patients presenting with cough, fever. Those folks are being tested for influenza and respiratory viruses as well. And of course, if they test positive for those things, then it's unlikely that they have the COVID-19. If they test negative for those things, then the likelihood of having the COVID-19, of course, increases. So as part of our public health response, as I said, we receive reports of persons that have are laboratory confirmed as having the virus. We in turn contact them, interview them, and then ask them about their close contacts. We in turn reach out to the close contacts, do an interview, and we then determine what their risk is for potentially getting this virus. So folks who are high risk would be those that are household contact of a symptomatic case, and folks who have had a recent travel history to areas where there's been widespread outbreaks of this disease, including in China. Those who are medium risk include those who are household contacts of symptomatic lab-confirmed cases while using recommended precautions. And you can read the rest of here. Some of the specifics of this slide are probably not that important, just to say that we have processes in place to classify what we call contacts of cases and to determine the risk, and then our decisions, the decisions, what we do with those contacts, what the recommendations we provide to those contacts are based largely on how we classify their risk. And again, this is just an extension of what I just talked about. These are some of the different risk categories and the different recommendations we have in place for these people, again, depending on what their risk is. A couple terminology issues, just to remind people. So isolation is a term used to separate ill persons from those who are otherwise healthy. And then quarantine, of course, is a term used to separate and restrict movement of well people who may have been exposed to the disease. So you all probably seen this curve before. And this curve is meant to reflect the impact of social distancing as a way to reduce the number of cases. So the area under the first curve, under the brown curve, where we do absolutely no interventions, you can see that there's a dramatic peak in the number of new cases early on, and whereas the second curve with the blue is the curve showing the peak in the distribution of cases with intervention. So the take-home point here is that if we do social distancing well, we can not only reduce that peak, but also extend the period of time over which cases occur. And the important thing here is that we can, by doing this and doing this effectively, we can reduce the impact on our healthcare system. And of course, one of the responsibilities of the health district is to try to get as much information out to the general public about preventing exposure to the virus. For example, washing hands, if using soap and water, if soap and water is not readily available, we recommend use of alcohol-based hand sanitizers that contain at least 60% alcohol. We recognize that there's a shortage of hand sanitizers as well, which is certainly a problem in the community. There are also things that people can do to make their own hand sanitizers, but again, based on my own personal experience, it's really been difficult to get the raw ingredients to develop your own hand sanitizers as well. But nonetheless, washing hands are very appropriate. Hand sanitizers are certainly a good alternative if they are available. Secondly, covering your cough and sneezes with tissues and then making sure you throw the tissue away, then washing your hands after you dispose of that tissue. Staying home if you're sick, don't go into work, school, or travel when you're not feeling well. Of course, this can prevent the spread of germs to others. Obviously, a lot of this is happening now because folks are being encouraged to stay home from work and school anyways because school is closed, workplaces are closed as well, and travel is heavily restricted. And finally, encouraging people to get the flu vaccine because it is still the flu season, even though we're at the tail end of our typical flu season. And then, as I talked about before, there's a chance that the virus can be spread through contact with infected surfaces, which is why we encourage people to clean and disinfect those surfaces regularly. And these are a list of approved disinfectants that people can use to do just that. And then in times of emergencies, we always recommend that people think about preparing for the next emergency by making sure that they have the appropriate equipment and supplies in place. So if this were to happen again, that they have at least some supplies available to get them through these kinds of events. So we do get a lot of questions about wearing face masks. The bottom line here is that we all recognize that there's a limited supply of face masks of many different types. So we want to make sure that those face masks are prioritized for those people who need it most. So the CDC is not currently recommending face masks for the general public. Masks are only recommended for caregivers of patients that are currently symptomatic. But there are certainly some challenges with the face mask. Surgical masks are designed to provide the wearer with protection against large droplets, splashes, or sprays of bodily or other hazardous fluids. The challenge here is that they are loose-fitting and don't provide the wearer with a reliable level of protection because there is a chance that the virus can become aerosolized and people can breathe that in. And surgical masks are not ideal for preventing those kinds of exposures. And lastly, this is just an example of one of many different kinds of fact sheets that are available. You can find those on our website that talk about the virus and steps to keep yourself healthy. And lastly, just a reminder about our information line, 702-759-INFO. It's available 7 a.m. to 7 p.m. I'll be happy to take any questions from the public during this time. And that's all I had at this point. I recognize that there's likely going to be a lot of questions and concerns that folks have, so I'd be happy to take those right now.
Just PowerPoint related, if you don't mind going back to the list of approved disinfectants, just so folks can kind of keep that in mind.
Sure, of course. Let's see if I can do that here.
Of course. Okay. So, yeah, doctor, we do have a question here that says, studies suggest virus particles can survive in the air for a few hours. Is there any evidence that you've noticed that speaks on that?
So evidence of the virus surviving in the air for, I think I've seen that evidence. I think the question comes down to whether or not those particles are actually infectious or not. But I will admit that I've not been keeping up on that specific kind of issue, so I don't know the specific answer to that question.
Okay. We have another question here. It says, if you work at a place that is essential, how do you best protect your employees, especially if they have to handle money and things along those lines?
Yeah, I think certainly decisions like that probably need to be made on a case-by-case basis. So folks are concerned about handling money that might be contaminated. You might want to consider having your employees wearing gloves as a precaution for them, as a way for them to prevent exposure to the virus. We don't recommend wearing face masks, of course, but certainly gloves might be a suitable something, at least something that can help protect employees from contact.
Thank you. We have another question here that says, why isn't there more movement towards quarantine of high-risk populations versus the entire population? Couldn't we deploy home health providers and other organizations to serve those high-risk populations while in quarantine, thus getting people back to work?
Could you repeat that, Carlos?
Of course. Why isn't there more movement towards quarantine of high-risk populations versus the entire population? Couldn't we deploy home health providers and other organizations to serve those high-risk populations while in quarantine, thus getting other people back to work?
I see. Yeah, that's a great question. I have not actually thought about that. I think the idea with having everybody in quarantine or everybody practicing social distancing is that with this virus we recognize that it's readily transmissible from person to person, regardless of whether or not people have underlying illness. Certainly, our goal is to protect the most vulnerable, but if we continue to allow large gatherings and a lot of person-to-person contact, we're going to continue to allow the virus to transmit from person to person, and the number of cases is going to grow exponentially. So anything that we can do related to social distancing, regardless of individual's underlying health status, is thought to be effective in terms of preventing further cases.
Okay. We have another question here about what you have maybe heard about individuals being reinfected by COVID-19 virus.
Yeah, I've heard some things about that as well. I haven't really kept up about the details about that, but I have heard that people can get reinfected. I don't know how extensive that has been or how important those people have been in terms of continuing the spread of the infection, but I have heard that it's at least a possibility.
We have another question here that says, how many tests have been performed, and how will we know how close we are to the peak if we're not doing wide testing?
Yeah, that's a great question. The challenge, of course, is if we don't have enough testing capacity, we don't really have a true extent. We don't have a true understanding of the extent of the epidemic, and therefore we really don't know exactly when it's going to peak and that sort of thing. I think, I don't know how to answer that question, and it's going to get more complicated if more testing does become available. Of course, it's going to change the dynamics of testing, and we're going to see some, a different representation in our curve. So again, it's a great question. I don't really think I have a really good answer for it, though.
Do you happen to know how many test kits are available currently in Nevada, or when those more tests might come through?
Yeah, unfortunately, I don't have a response to that either.
Okay. Where are people who are asked to self-quarantine advised to stay if they live in homes with high-risk individuals with pre-existing conditions?
So if someone's asked to quarantine, meaning that they're not having any symptoms, but they also share a household with someone who's high risk?
Correct.
Okay. Yeah, certainly under those circumstances, it's not an issue because that quarantine individual, if you will, is not currently symptomatic. But certainly if they were to become symptomatic, then we would recommend that they do their best to limit any contact with any high-risk individual in that household. And there's certain specific kinds of steps that they can take to do that. For example, using different bathrooms, isolating themselves into certain rooms, things like that. And there's more guidance available on the CDC website that talks about that.
Okay. How can we ensure that patients are quarantined at hospitals or other locations when waiting for test results if they are living in congregate locations like shelters or transitional housing with shared living?
I'm sorry, can you repeat that again, Carlos?
Of course. How can we ensure that patients are quarantined at a hospital or at another location when waiting for test results, especially for those folks who are living in congregate locations like shelters or transitional housing with shared living?
Yeah, that's an excellent question. We don't currently have any mechanism in place to enforce any quarantine. So all the quarantine is done on a voluntary basis. So the best that we can do is to provide people with very specific information and guidance. In some cases, we will provide them with a letter with instructions. That way, we got something in writing to say that that we recommend that you be under quarantine. But we currently don't have any mechanism to enforce that at this point. Nor do I think we ever will get there.
Of course.
Yeah, go ahead.
If you're older and have a lower immune system and suddenly get a cough, is there a sign that there could be a problem?
So someone who's older, who's otherwise immunosuppressed, and they develop an onset of new cough, is that an indication of a potential problem? Certainly is. Cough is one of the hallmark features of this virus. Certainly, depending on the person, I would recommend that they call their healthcare provider, talk to the healthcare provider before they go into the clinic. The provider can do a quick assessment over the phone of whether or not a visit to the provider is indicated, or if the patient's symptoms are serious enough, whether or not that patient needs to go to the emergency department. But I think the key here is that if people have new onset of symptoms, they're concerned about it, call the provider first. The provider can do a quick assessment over the phone and can determine whether or not it's necessary for that person to come in to see the provider or not, or for that person to go to the emergency department.
Has there been any research of what the average age of somebody who carries the virus is?
That's a great question. I'm sure there is data on that. I don't have that handy with me, but I will say that people of all ages have been identified as being infected with this virus, but it's generally the older folks and folks with underlying health conditions that are found to have much more severe illness, require hospitalizations, and are at greater risk for death.
We have another question here. Are hotels advised to allow infected self-monitoring patients?
I didn't hear that last part.
Of course. Are hotels advised to allow infected self-monitoring patients to check in? So those who might be doing self-quarantine and be able to check in to ensure that they are not spreading the virus through a community contact.
Yeah, that's a good question. I've not heard that question come up before. We've had situations where we've had folks who have been hospitalized with this disease and are able to be discharged from the hospital, but otherwise have no place to go. There's some very specific guidance from CDC that talks about when that person can remove themselves from self-isolation, if you will. But I don't know if there's any specific guidance for hotels with the situation. Yeah.
Okay. I don't know if you might be able to answer this, doctor, but how would you define essential versus non-essential services in the medical field? For example, outpatient clinics, occupational therapy, and physical therapy.
Yeah, I don't know if I can define that myself. I think it really comes down to the availability of resources as well as staff. So if things get into a real bind, then certainly that's going to be different than if the number of cases in a particular community is not so bad. So again, it comes down to availability of resources, PPE, medical equipment, supplies, as well as staff.
Okay, thank you. So we've kind of heard a lot through the news of there might be some outlets for testing, things like that. Would you happen to know any organizations that are currently handling this issue by providing drive-through outlets for testing COVID-19?
I'm not aware of anybody here in the Valley that's doing drive-through testing. I know there's been some talks at the federal level of potentially making some resources available to states in terms of test kits, personnel, and other capacity to support more like community-based testing, but I don't have any specifics or details about where that particular idea stands at this point.
Thank you, doctor. We have another question here. There are fast rising numbers of 20 to 40-year-olds with no underlying conditions becoming extremely ill. Many are on ventilators. Why do we keep focusing only on the 60-year-old plus population? Shouldn't we be warning all population to the extent of everyone's risk?
Yeah, that's a great comment. I think generally the risk is greatest for those who are older and have underlying health conditions. That's not to say that folks of other ages, including those 20 to 40 who have no underlying health conditions, are not at risk for severe illness or death. I just think it comes down to what's the actual absolute difference of risk between the younger versus the older, and the risk, of course, is higher for those older folks with underlying health conditions.
So would you happen to be able to comment on what the process or the timeline is for creating more test kits?
Yeah, that's a great question. I unfortunately don't have an answer for that. I wish I did, but I just don't.
Of course. Somebody has heard that at one point that 4 out of 5 those who are infected are asymptomatic. Would you happen to know if this is true, and would the severity of this pandemic be dramatically reduced?
I don't know if it's right to say that 4 out of 5 are asymptomatic. That would require testing large numbers of people who are otherwise who are not symptomatic. I do know that of those who are infected and tested, about 80% or 4 out of 5 of those people have what we refer to as mild illness, and 20% who are infected with the virus have much more severe illness. So perhaps that's what the person who provided the question was referring to.
Sure. We have another question here. Do HEPA air filters work to help reduce exposure to airborne risk?
Yes, absolutely.
Okay.
Yeah, anything that's been certified by NIOSH or OSHA as a like, for example, a HEPA air filter or N95 mask more commonly, those are very effective in preventing exposure to aerosolized particles.
Since the collection of kits aren't readily available, where should we be sending suspected patients? To the ER, Quest, LabCorp?
So, this is partly informed by the availability of tests. So obviously, in the situation where testing supplies are abundant, then it would seem okay to test a large number of people in the population, including those people who are otherwise not severely ill. But given the current state of the current number of test kits available, certainly we want to try to prioritize those tests to folks who have much more severe illness and may require hospitalizations. So, for example, I know some of the emergency departments here in the Valley, they're only testing people that present who will likely be admitted to the hospital. Other people that may be showing signs or symptoms of this virus who are not having severe illness and who would not need to be admitted, they're not testing those folks, but just sending them home with information, instructions, and advising them to self-isolate for 2 weeks. Because the reality is, it's going to take a few days for the test result to come back positive, and there's really nothing that can be done to manage that person at the hospital. So instead, advice is given, instructions are given to have that person go home and self-isolate.
We have another question here. With the shortage of personal protective equipment in general, where or how can more personal protective equipment be available to all those who need it?
Yeah, another great question. I do know that part of the activities here at the health district is to work with our health systems to monitor the availability of personal protective equipment, and then try to see where we can work to try to get some of those additional resources. But it's a challenge to say the least.
Okay. We did want to share a comment here by one of the listeners that said that Sahara West Virgin Care doesn't even have some test kits available. Probably should call ahead if that is the case, but that was a comment that was made by one of the users. Another question that we have here is that at home, should one turn off the AC to help spread the risk of of receiving the virus airborne?
No, I wouldn't think that would be necessary. No.
Okay. So, folks, if you have any other questions, you could please go ahead and write them out in the chat feature of this webinar. And if we don't have any other questions, well, first of all, Dr. Lohff, we really do appreciate your time and being able to host this for members of the business community. I guess we do have one last question here coming in. Does asymptomatic mean that a person never shows symptoms the entire time they're sick with the virus, or does it refer to the time or period before symptoms appear while they are contagious?
So asymptomatic generally refers to those people who are thought to be infected with the virus but show no symptoms at all during the course of their illness. Okay. So certainly, but people that there certainly could be it doesn't necessarily refer to people who are not showing symptoms but would later develop symptoms. That's usually not the way how that term is applied.
Is there any organized effort to get personal protective equipment from surgeons who provide elective surgery?
There's likely discussions within the hospitals and healthcare systems. I know this question came up at a meeting I was at recently where they were talking about suspending or potentially suspending elective surgery to make resources such as PPE more widely available to assist in the response, as well as, of course, make more healthcare workers available to assist in the response as well. So it certainly is an idea out there, and I think it seems like a good and valid one. But I don't know if there's any, there's currently no like widespread policy, at least at this point in the state, for restricting or canceling elective surgeries.
When it comes to cleaning and disinfecting, should soft materials such as seatbelt strips be wiped down with disinfecting wipes?
Yeah, I don't know the specifics of that. I think any kind of product that you can throw in the wash, that would be a good way of cleaning that surface. Because I know it is obviously challenging to disinfect an otherwise soft surface, cloth surface, whatever. But a disinfecting wipe likely would be a good alternative to actually throwing a product in the wash if you can't otherwise put it in the wash.
Based on the asymptomatic definition, is there any evidence to support that spread occurs during the incubation period before symptoms are happening with the patient?
Yeah, and it's certainly possible, and there's been some evidence to suggest that people can spread the virus before they actually develop symptoms, and that's one of the challenges with dealing with this virus, of course, if a person's spreading the virus before they're symptomatic, then it becomes a challenge for trying to prevent the spread of it, of course.
Okay. And would you, from your perspective, would you be able to comment on the availability of blood products, such as just having blood available for patients as they're getting hospitalized and things along those lines?
Yeah, unfortunately, I don't have any information about that other than what I've read, like in the media, that there's concerns about potential shortages of this, but I don't really have any information that would be available that's not otherwise available to the public.
Perfect. Well, that seems to be our last question, Dr. Lohff. So we truly do appreciate your time, and thank you all on the call for tuning in and asking questions. Again, Dr. Cort Lohff from the Southern Nevada Health District, and thank you all to the policy committee chairs who have made this possible. Thank you, Dr. Lohff, for your time, and members, please stay tuned at vegaschamber.com for any resources for your business and the community as well. Thank you all.
Thank you.